If you are treating sleep apnea and still waking up tired, there is one daily habit that may be quietly making it worse, and most people don't realize it. Sleep apnea isn't just about snoring. Over time, untreated or poorly managed sleep apnea increases the risk of high blood pressure, heart disease, stroke, and faster biological aging, especially after 40. And yet, many people feel they are doing everything right and still don't feel rested. In fact, tonight, millions will wake up gasping or snoring, and most people blame sleep habits alone. But there is one under-recognized lifestyle factor that makes apnea worse. I am a practicing physician, and what I have seen again and again is that many people focus only on machines, medications, or diagnosis, while overlooking a few daily habits that quietly sabotage their sleep. In the next few minutes, I want to walk you through 3 evidence-based lifestyle changes that can reduce sleep apnea severity naturally without relying only on machines. And let's start with the one I see most often.
Late evening eating is one of the most underestimated contributors to sleep apnea. When you eat close to bedtime, stomach pressure increases, acid reflux becomes more likely. That reflux doesn't just cause discomfort, it irritates and inflames the upper airway, making it easier for the throat to collapse during sleep. Studies have shown that people with sleep apnea who eat later in the evening have more frequent breathing interruptions and poorer sleep quality overall. Other research also shows that eating within 3 hours of bedtime is linked to more nighttime awakenings. For many people, simply stopping food at least 3 hours before bed reduces reflux, calms the airway, and allows deeper, more restorative sleep, often within a few weeks. And this next habit often surprises people because it feels harmless. Even small amounts of alcohol relax the muscles of the throat, and those are the exact muscles that need to stay firm to keep the airway open during sleep. When those muscles relax, the airway narrows more easily, increasing breathing interruptions and drops in oxygen levels. In fact, clinical studies have shown that alcohol before bedtime increases both the frequency and severity of apnea events, even in people with mild sleep apnea. Importantly, these effects occur even with moderate drinking, not just heavy alcohol use. So even one drink, especially within 4 to 6 hours of sleep, can significantly worsen apnea episodes and can quickly undo otherwise good sleep habits and worsen sleep apnea without most people realizing it. Okay, let's talk about something you do every night without thinking about it. Now, sleeping position matters more than you think. Sleeping on your back allows gravity to pull the tongue and soft tissues backward, narrowing the airway. For many people, this dramatically increases airway collapse and the number of breathing interruptions during sleep. Side sleeping, positional pillow, or even simple techniques to avoid back sleeping can reduce apnea severity in certain individuals. Most importantly, we now know, based on documented clinical studies, that fewer apnea events and improved oxygen levels occur when people sleep on their side instead of their back. This is why positional pillows or simple techniques to prevent back sleeping can be surprisingly effective. Sometimes small physical changes make a big physiological difference. Let's briefly talk about common myth regarding sleep apnea control. Many people believe that exercise alone will fix sleep apnea. While exercise is powerful, it doesn't override poor timing, alcohol use, or sleep position. Sleep apnea is about patterns, not just effort. Listen to this. If you want to reduce sleep apnea naturally, focus less on perfection and more on timing and consistency, not tools. Stop eating late. Avoid alcohol near bedtime. Pay attention to how you sleep, not just how long. These small changes often work together to create meaningful improvement.
So, if this helps you think differently about sleep apnea, you can like the video so others find it too. And if you want science-based wellness guidance focused on healthy aging, consider subscribing. And I will see you in the next one.